At first glance, I would suspect that the woman is suffering from some form of dementia. Alzheimer's occurs because progressive brain atrophy and development of senile plagues. This woman is disoriented and combative, and those are two signs of Alzheimer's. She is wondering like she does not know where to go or has nowhere to go. Either way, she seems delusional. Another symptom of Alzheimer's being hostile towards others. She is hostile. Her adrenaline could have caused all kinds of things, including her loss of balance, which aided in her fall. People with Alzheimer's can be withdrawn, and this woman did not want anyone to touch her to prevent her and to prevent anyone from bothering her. She began to accuse them of stealing her purse. She was not found with the purse. There was no way of knowing where her purse was or if she even had one. She seemed to have been wandering for a while because she was dirty and smelled like urine, and her body had an odor. The short-term health risk could be that she was in danger of herself because she is disillusioned and harm herself and put herself in harm's way. She may not trust anyone to treat her injuries, which could cause them to get infected. Long-term health risk could be that her brain could continue to be disoriented and could cause her other problems. The brain controls the body, and this slowly deteriorates. The parts of the body that the brain controls will start to fall or deteriorate. The neurons in her brain stop functioning normally. The hand shakes and the tremors could also result in damage to the brain from early onset Alzheimer's. With Alzheimer's, there is short-term memory failure, impaired ability to think and concentrate, unable to reason normally and learn new information, as well as confusion or disoriented. There could be changes in personality, speech, sleep patterns, and the ability to perform a normal task. This progression of this disease occurs over a period of 5 to 10 years. The patient gradually needs more care. Persons diagnosed with Alzheimer's often become emotionally detached and hostile towards others around them. Alzheimer's cannot be cured, and it is not known for sure that a person has it until after their death. The diagnosis is based on the loss of neurons present in senile plaques and the visualization of microscopic amyloid deposits. There are some treatments that may elevate cohesiveness symptoms, but there is nothing to recreate the neurons that are lost. There are some prescriptions, dietary supplements such as AVOS, vitamin B12, and a combination vitamins called calcium. There are many medications that are used to help with the symptoms, but it has not been anything that can recreate the neurons, get rid of the senile plaque or the amyloid deposits. This patient needs to see a neurologist to first determine if she has any loss and if there is evidence of senile plaque or amyloid deposits. If there is evidence of Alzheimer's disease, then the doctor can prescribe donepezil or some other inhibitor that helps with the congestive symptoms, and dietary supplements to aid with other symptoms. Mental health is diagnosed by medical professionals. These professionals can write prescriptions for these illnesses because there are medications that can help treat some mental illnesses. Due to the nature of some mental disorders, such as schizophrenia or bipolar disorder, the insurance companies cover treatments and prescriptions for their illnesses. The insurance companies have policies in place for medical professionals so that they'll get prior authorization before performing the service, and some hold true for prescription medications. This is sufficient to those that can afford the premium insurance, but and get to the problem when the services are limited due to the type of insurance coverages. This could be improved if it were better insurance companies had premiums that were more affordable for everywhere and not just limited. Thanks.